Assalamu alaikum, dear students. Today the topic of our lesson is All is Not Lost. This is a lesson taken from the English book of grade 9. Today we will discuss words meanings and question answers. Now I am going to mention the learning objectives. At the end of the lesson, the students will be able to tell the meanings of the difficult words and use them in sentences of their own. Write answers to the given questions. First the in-text questions and then the questions given at the end of the lesson. The first part of the lesson is words meanings. The first word is profession. Profession means occupation, job. The second word is neurology. Neurology means the study of nerves and nerve cells. Devastating. Devastating means shocking. Neurons. Neurons mean nerve cells. Recruit. Employ. Popping up. Appearing. Crutches. Support, gradually, slowly, miserable situation, very unhappy situation, upset, worried. The next word in the lesson is acute. Acute means severe or intense. Next is physical disorder. It means a condition that affects a person's health or mobility. Severe. Severe means very great, intense. Meanwhile. Meanwhile means during the time, in the meantime. Unattended, unnoticed, whenever somebody is not attended. Justify. Justify means to show or prove to be right or reasonable. Then considerable. Considerable means great in amount or degree. Gratitude. Gratitude means thankfulness. Next is senior. Senior means elder or more experienced people. Risk. A situation involving exposure to danger. And now we are going to answer the questions. There are two types of questions. The first one is in-text questions. I mean questions in the text and questions at the end of the lesson in the exercise. So first we are going to discuss the in-text questions and their answers. Question number 1. What is an ICU in a hospital? Answer. An ICU is a ward in a hospital into which those patients who are in a critical condition are admitted and closely monitored for their better and complete recovery. The train stop of the hospital takes care of such patients around the clock. Question number 2. To what extent does the recovery of a patient depend upon the doctor and the nurse? Answer. The recovery of a patient depends to a great extent upon the doctor and the nurse because their care, proper treatment and medication play a great role in the recovery of their health. Their gentle and kind behavior are also important in the recovery of a patient. Question number 3. What do you infer about her professional skills from the expression "try once for her"? Answer. The expression "try once for her" shows that she is a very determined, kind, wise, sincere, honest, devoted, kind-hearted and caring nurse. She had positive thinking and a strong willpower. Question number 4. Identify kinds of noun used in the text. The first kind is common noun. Common nouns in this part of the lesson are nurse, patient, work, doctor, in charge, ward, case, bed, family. And another kind is abstract nouns. Abstract nouns are surprise, battle, career. Now we come towards exercise questions and their answers. Question number 1. Why did the nurse ask Hera's sister to come and talk to her? Answer. The nurse asked Hera's sister to come and talk to her because she was of the view that the voice of a near and dear one could activate her nearly dead neurons. She thought that Hera's brain might start working on her sister's voice. Question number 2. Why did the nurse disagree with the doctor's point of view? Answer. The nurse disagreed with the doctor's point of view because she thought that the doctor's viewpoint was not logical. According to her, only full attention and proper care could make her patient recover. She intended not to give up her efforts for Hera's recovery. Question number 3. Why did the nurse ask herself the question, could I be able to justify my stance before the senior doctors? Answer. The patient was a hopeless case in the eyes of the surgeons, and they wanted to get the bed cleared for other patients. The nurse requested the senior doctors to let her stay in the ICU and allow her to attend to the patient. Her request was conceded to. She had risked her career for a hopeless case. She also thought that it would not be worthwhile to oppose the senior surgeons if the patient could not walk on her own feet. Question number 4. Describe some qualities of the nurse in the story. Answer. She is wise, devoted, sincere, honest, kind-hearted and ambitious. She had positive thinking and strong willpower. She is very sincere to her profession. She is so kind-hearted that she feels the pain of the injured persons. She is an optimist. She is always ready to fight a lost war. She is proud of her profession. Question number 5. Why did the nurse say, where there is a will, there is a way? Answer. It means that the paths of life are open to those people who have strong willpower to do something. If we are determined, we can always find the way to do it. The impossible tasks are accomplished by those who have strong will and positive thinking. She said so because she proved it practically that a hopeless patient could be cured if one is willing to fight a lost war.